Welcome back to our attendees. Our next speaker, Mr. Mohamed Ahmed, Industry Value Advisor, Healthcare at SAP, speaking on today's topic, Intelligent Hospitals. Over to you, Mohamed.
Thank you. Welcome, everyone. And as Melwin mentioned, I'll be talking about the Intelligent Hospital offering from SAP. I think SAP is well known as an oil and gas brand or a retail brand in software, but I think very few people know SAP's experience in healthcare. And this is not something new. Actually, SAP works in 25 industries, and the second industry we ventured in back in the late 70s was healthcare. And today I'm going to shed light about what is the Intelligent Hospital from SAP and how did we combat by that solution. So starting off, I'll just discuss quickly the healthcare trends that we're currently seeing in the market. So the first one is the dynamic ecosystem. Of course, there are mega trends such as value-based healthcare and personalized medicine, but what I'm trying to talk about here is the impact of certain events on the market and the trends that are driving the market on a bit lower level. So the first one is the dynamic ecosystem, where we're seeing a lot of interaction or shifting of roles between different entities in the healthcare value chain. So previously we had payers, we had providers, we had pharma companies or suppliers, and each one is really comfortable in their own play. But we're seeing now a lot of shifting of this ground, and we're seeing providers go into the payers game by providing more comprehensive offerings directly to employers and bypassing the payers. We're seeing payers bypass the providers and giving own distinct offerings for their patients directly in order to control the patient experience, such as very famous insurance providers who have opened their own outpatient clinics. So this is one of the main trends currently affecting the market, and it really restricts or unrestricts healthcare systems on their traditional platforms and requires them to have a much more wider view of digital transformation and the platforms that they need in order to optimize their experience. When we talk about the rise of diagnostics, we're talking about the diagnostic process. So most of the money or the focus previously was on the treatment process. So hospitals were there to treat patients, and most of the focus was on optimizing that treatment process. And due to the standardization of care and the kind of the commoditization even of the clinical care process, the focus now is more on the diagnosis. I'm sure anyone who has been a patient or had a family member who's currently a patient, the really challenging part is figuring out what's wrong. Once we know that what's wrong, more than 70 or 80% of the time, it's really easy to treat it. So the whole diagnostic process and understanding how to structure it is gaining a lot of importance right now. And even my suspicion is that the payment models will really change to reflect that and focus even on the diagnostic process, not just on the treatment process, which is happening right now. The third aspect is the standardization of care. So we're seeing more and more hospitals try to control and standardize care. And this is not just due to cost aspect, it's also to improve quality. And from a cost perspective, more than 50% of waste in healthcare is due to the clinical practice variation. So every department or every physician has their own workflow or own pathway within the organization, which creates a lot of variation in terms of cost. Of course, we cannot standardize everything, but the more we standardize, the more we have a structured process and the more we're improving quality and reducing costs. The fourth aspect is the consumerization of the patient experience, or patients as consumers. More and more we're seeing patients want to have the discussions on their own terms with hospitals. So it's very easy for you to open your mobile and book a ticket in 5 minutes, but it's impossible to do that with a hospital. So this is, I think, one of the biggest challenges in healthcare right now, and patients are demanding this, and soon hospitals will have to face the reality when it comes to the consumerization of the patient experience and start providing the tools and the experiences to patients where it's very easy for them to interact with their providers. The fifth aspect is the continuous escalation of costs. So I think in many GCC countries, healthcare costs are escalating by some estimates around 15% per year. So understanding our cost structure and continuously optimizing our cost is really important for us in order to survive as a hospital. So because it's not just about managing the costs, it's also about profitability, especially for private healthcare providers, or even sustainability when we talk about public healthcare, because it's not sustainable anymore to kind of give unwaived support to costs. We need to manage them properly, of course, while considering the patient experience and safety, but also putting them or bearing them into mind all of the time. And finally, the war for talent and how we talk about the clinicians and how we manage them and engage them. Clinicians are in very high demand, especially when we're talking about skilled ones. So we need a platform to help us engage with them and continuously understand their emotions and feelings and engage them, and even manage their performance and costs, because healthcare costs around 40% to 60% even is workforce costs. So this is the biggest cost element in healthcare, and the one that really affects the experience of care and the performance of our organization. So the war for talent, again, is one of the very important healthcare trends that we're seeing. So jumping into kind of a level down into hospitals. So how do these challenges really affect hospitals if we take it a notch down? So I think there are three main aspects, and we as SAP have been designing our processes to address these three mainly, but across many others. So the first one is the departmental silos. So we're seeing lots of challenges in healthcare due to the fact that departments are designing processes around their workflows or their processes without regard to the patient experience. So the patient accounting department designed their processes around their the input and the outcome that they need. The physicians do the same. The administrative people do the same, but there's no link between these different departments, and this creates a lack of patient orientation, which is the second aspect, and the patient is not at the middle, and it creates huge hurdles from a patient experience perspective, and not just from a patient experience perspective, even financially from a revenue leakage perspective, because the front office and the back office are not integrated. We don't know what's being consumed in what patient, what's the cost of delivering care for this specific patient. All of these are challenges that are a result of lack of patient orientation. And finally, the single source of truth is missing. It makes it really difficult for decision makers to understand what's going on in the hospital or take decisions. Different departments are working within different processes, and everyone, it's very difficult to collect this data, and it's more difficult to correlate this data. So even if I have the data and I'm able to collect it, I cannot correlate the data that I collected from the financial department with the material management department with the clinical operations, and it becomes a really huge mess for hospitals to be able to do that. So before showing you what SAP has to offer and what we do in healthcare, I think the quadruple aim of healthcare, which is a model created by IHI, which is, from my perspective, one of the leading healthcare consultancy firms in the world. And the quadruple aim is what we need to address when we're talking about any kind of transformation, whether it's digital, whether it's functional. All of that requires to address any one or more of these pillars. It needs to improve population health, reduce the cost per capita, improve the experience of care and the clinician experience. Any of these processes needs to be well defined. Any of the processes within your hospital needs to address one or multiple of these main pillars. So when we talk about the intelligent hospital from SAP, it's simply an end-to-end value chain for supporting healthcare organizations in delivering care in a digital medium. And we have, SAP is very well known for its process orientation. So many of the companies, whether they're healthcare specific or technology specific, they focus about the input. Our main experience about SAP is how to design the process while catering considering the input and output in consideration as well. So we have designed our intelligent hospital around the main processes in healthcare. So we start by the monitor to prevent process, which focuses first on continuously scanning populations, whether they are populations that you are serving as a private hospital or a public or healthcare organization. And SAP provides you the tools to continuously scan these populations, whether through integration with different hospitals, through directly collecting information from the patients, and provide you even with the tools to communicate back to the patients. And this is really important right now when we talk about chronic disease management, because it's not only about managing patients within hospitals. Most of the patient life is outside of the hospital, and the facts that help them or kind of escalate their sickness or symptoms are related to their lifestyle and their behavior. So capturing that information and communicating in a personalized way back to the patients is really important and gaining a lot of traction, especially at the public sector and payer level. The second process, which is really important, is drilling down within a hospital. So when we're talking about a specific hospital, the diagnosis to recovery process, how do we diagnose patients? How do we ensure the proper documentation which helped us arrive at the certain diagnosis? And once we do that, how do we treat the patients? How do we ensure proper recovery and even support them after they leave the hospital with specific care plans that are suited to the patients based on their conditions and their lifestyle, which is again a very important aspect when talking about healthcare. And from a clinical perspective, we're talking about diagnosis to recovery, and admission to cash focuses on the administrative aspect of delivering healthcare. So how do we ensure the proper scheduling of patient appointments? How do we map our facilities, our equipment into proper scheduling applications so that we are ensuring that we are utilizing them to the maximum and ensuring that we're even localized for the region? So how do we, for example, manage overbooking, which is something very common in the region over here? All of that is part of the administrative aspect. And the second aspect is the patient accounting, which is the revenue cycle management, managing the claims process, the insurance relationships, and even the pricing aspect, which is again a really important process in delivering care. The data to insights process focuses on how we collect data from these processes and from other processes in order to get you insights. How do we correlate data from the medical or EMR system to the revenue cycle management to the ERP, and how do we collect all of this data and even provide you with out-of-the-box content which is specific to healthcare? So when we talk about data to insights, we're talking about specific dashboards and KPIs that are related to patient experience, patient quality or clinical quality, denials management, population health. All of these KPIs are built out of the box in SAP in our data platform or business analytics platform, which help you understand the impact or help you even make decisions within your organization. And most importantly, at the middle, the patient experience management. So every one of these processes, or even the back office processes, touches upon the patient experience. And the patient experience management is the most, or one of the most important aspects right now for any CEO or any healthcare provider. They need to understand their patients, they need to communicate properly with them, and they even need to take action in real time. This is becoming more and more important, and I think one of the unique value propositions of our platform is the capability to capture data and even take action in real time for patients in order to improve the patient experience and the experience of care. And when we're talking about the support functions, which is again the base pillar which help us deliver healthcare, we're talking about the source to pay processes. What do I need to buy? When do I need to buy it? How much do I need to buy it from? Who do I need to buy it from? And how do I consume it? All of these are important aspects of delivering healthcare, and the source to pay processes or modules help you implement that. When we talk about the HR, we talk about the hire to retire. How do we improve the clinician experience? How do we recruit people? How do we onboard them? How do we measure them? How do we ensure that we're continuously upskilling them and training them and capturing their CMEs, for example, and how we even offboard them or retire them? All of that is part of the clinician experience and the HR processes, including, of course, standard processes such as rostering and payroll. All of that is part of the hire to retire process. The acquire to retire process focuses more on your facilities and equipment. How do we acquire them? How do we maintain them? Even if we're not maintaining them directly and we're outsourcing the maintenance to other third-party providers, but we need to track that process. We need to ensure a maximum uptime of our resources, whether they're facilities or equipment, because if my MRI machine has a downtime of 3-4 days, that's lost revenue for me. So continuously being able to optimize that process, even if I'm not handling it directly, is really important for hospitals as well. And finally, the record to report, which is the financial aspect. So, which might seem like the easiest aspect and the most straightforward aspect, but from my perspective, it's the most complex one. Mapping care and medical services, revenue cycle management, materials into a balance sheet is really, really difficult. Any CFO will confirm what I'm saying. And I think this is where SAP has a very strong value point, because this is one system and one integrated solution, and it will help you capture all of this data and flow seamlessly into your P&L and revenue cycle management and financial systems. And it's not only about capture, it's also about extraction of data and management accounting. How do I manage my cash? How do I manage my profitability and costing? How do I understand the cost per department, per service, and play around with it? How can I see who are my best performing physicians? Who are my worst performing physicians? All of that is part of the record to report and the financial aspect of delivering healthcare. So what does this intelligent hospital help you do? Assuming that we understood the previous slide and we understand the value proposition of what SAP and the end-to-end offering. It will help you do multiple things. It will help you reduce clinical practice variation because we're standardizing care and we have the tools to do that, such as order sets and care plans, which are features within the system that help you standardize care in our EMR application. We help you reduce stock write-offs due to the integration between the front office and the back office, since it's one system. So whenever something is consumed in medical care, it will automatically reflect from a supply chain perspective. So it will help you reduce stock write-offs. Will help you improve employee retention. Employee retention accounts, I think, to 5% of a P&L, given that employee costs are usually 40 to 60% of healthcare providers. So continuously improving your employee experience and reducing employee retention not only has a positive effect on your patient experience, but even on your P&L as well. We also help you reduce the average cost per unit when we're talking about our sourcing techniques. We have helped customers here in the region, hospitals, reduce their average unit cost by 8 or even 15% through our sourcing technologies and sourcing tools. All of that is part of what we do. We also help you improve your OR utilization, given that this is one of your biggest cost centers in a hospital. And we also help you improve the patient satisfaction. And we have customers where we improve patient satisfaction by 25%. We also help you improve patient safety and patient quality by reducing medication errors and other kind of standardization aspects in healthcare. And finally, one of the most important ones and the biggest challenges currently in healthcare, we help you reduce insurance rejection. And we're seeing customers here in the region who have brought down their insurance rejection rate by 3 to 4% just by using SAP solutions. So it's not just about the solution and the offer, it's also about the value drivers and the benefits, whether they're financial or quality based or even experience based for your organization. So I'll be focusing on the HIS part because I think this is one of the most hot topics right now in healthcare. And these usually address two main processes, the diagnosis to recovery and the admission to cash. So we have a partnership with Cerner. As you can see, this yellow box is one system. It's not just one technical system, it's one database, one schema, and it does not only mean that we are connected technically, but even connected on the business process level. So SAP provides the ERP and the patient management, and Cerner, our partner, which is the leading healthcare IT company in the world, provides the electronic medical record. And the electronic medical record part focuses on the delivery of care. Cerner developed this solution, or EMR solution, on top of SAP technology, which is the reason of the deep integration both on the technical and functional level. And the capability also of this solution is to integrate with different clinical decision support providers, whether Elsevier or others, to continuously optimize your decision support and improve your patient care and quality in your hospital. And we also help you understand your outcomes, whether they are patient-reported outcomes or business outcomes, and even measure your experiences with our Qualtrics platform. So drilling down a bit, what does that mean? So if you recall, one of the biggest challenges that we had was putting patients in the middle. And I think due to the deep integration between this platform and the issue that it's one system, we help you put patients in the middle and design your processes around them. So the first, or the foundation layer, is the SAP ERP, in which you're capturing your facilities, your supplies, your contracts, your purchase orders, your equipment, your financial statements, your accounts receivable, your accounts payable, your costing and profitability analysis, and your people, including the core HR, administration, and payroll. The second layer we provide in the same system is the SAP patient management, which helps you focus on the administrative processes. So we can help you define the different venues that they have, whether they're outpatient, inpatient, day surgery, ER. All of these are different venues that will be handled in the system. And of course, we have a very sophisticated scheduling tool that will help you schedule your appointments, including the features that are very advanced or required here in the region, such as overbooking, underbooking, scheduling per physician, scheduling per equipment, scheduling per department. All of these features and dimensions are available out of the box for the system to help you play around. And on the other side, we talk about the financial aspect, or the patient accounting. How do we manage the insurance contracts? How do we have the inclusions, the daily limits, the ceilings, everything? How do we capture all of that information? How do we manage the claims process and the integration with the different insurance providers? How do we manage our different price lists? This is one of the biggest challenges in hospitals right now. I have an internal price list. I have a price list, or a DRG price list, for the government. I have a different price list for a different insurance provider. How can I maintain these multiple pricing lists with minimum maintenance, and even map them together? So this is the second layer, or the SAP patient management, which is, as I mentioned, just to refresh your memory, a scheduling application and a revenue cycle management application as well. The Cerner part focuses on delivering care, or the clinical aspect. So there are multiple modules, and of course, just to backtrack a little bit, all of these modules are connected, but scalable. So I can start with the ERP and then do the patient management. I can start with the ERP and the patient management and do the clinical later. So it provides a scalable approach, and even within, for example, the medical modules, we don't have to start with all of them. We can focus on processes and continuously or gradually increase our coverage or our digitization of the organization. So when we talk about Cerner, we're talking about the surgery module, which focuses on the complete OR process, from planning to execution to the post-operative procedures, the pre-operative procedures, even the anesthesia and the linkage with the anesthesia machines. All of that is part of the surgery process. When we talk about the pharmacy process, we're focusing around the closed loop medication, starting from prescription until administration. How do I prescribe medicine electronically? How do I ensure proper interaction with clinical pharmacists and our supply chain? Because again, it's one system. So I can prescribe something and the clinical pharmacist can override it due to stock levels. All of that is part of the capability of the system. Or I can even only allow physicians to prescribe generic drug brands, or even the clinical pharmacist to override the branded prescriptions with generic. All of that is part of the workflow, and it continues with you until the actual administration, the dispensing and the administration of this medication as well. We also have a comprehensive nursing module, which includes the care plans and the planning for care, and providing nurses with the tools that they require in order to assess the patients, treat the patients, and continuously monitor the patients through their care plans. The computerized physician order entry is again a very important aspect, especially when we talk about physician adoption. So one of the biggest challenges for physicians is using the system, and we need to make it easy for them. It doesn't make sense for a physician to order a lab test, prescription, and a surgery all in 3 different transactions. SAP and Cerner provide the functionality to combine all of these clinical orders in an order set, and even link it to specific diagnosis. And with one button, I can choose all of the orders that are relevant to this specific diagnosis, or even change them a bit and push them into the system. So all of that is part of the aspect. So I think my time is up, so I'll just wrap up quickly. We are also available offline to answer any of your questions, and we also have the capability to integrate with clinical content providers such as Elsevier, as I mentioned before. And finally, this is a quick overview of our references both globally and regionally in the region. And I think we just had a new one in Oman, which is the Comprehensive Cancer Center, and more to come, inshallah. Melwin, over to you.
Thank you, Mohamed, and thank you for your presentation. If there are any questions, we will ask the attendees to address it to you, and you can reply to them directly.
All right, thank you very much. Thank you.